revealed 1.3 million people with cancer, arthritis, and more could lose PIP, that's personal independence payments, under Labour's benefit cuts, taking money away.
1.3 million.
That is a huge number of people.
Again, this is why they try to cover this stuff up. So remember in the run-up to them actually implementing the cuts and doing the statement in the House, Liz Kendall did a statement about what the fiscal elements of this would be. Again, the fiscal elements that they are not consulting on. They are not consulting on it because the previous Conservative government tried to also do a consultation and were found to have been unlawful because there was a false premise of it being about being good for disabled people. It was just about penny pinching for the Treasury, right? The fiscal elements that they talked about, why Liz Kendall was asked previously, have you done an impact assessment? And she refused to answer because, of course, they had to do a Freedom of Information Act request to get this, right? They had to FOI it to actually find out because the Labour government weren't forthcoming. Of course they weren't going to be forthcoming because the numbers are absolutely fucking stratospheric as the amount of people who are going to be affected by this.
Yeah. And they knew that, and they decided to essentially try and bullshit their way through it.
Mm-hmm.
Yeah.
Which makes it even more embarrassing and disgusting, really, for Keir Starmer to talk about, saying that he puts dignity and respect at the heart of his politics. We couldn't even respect disabled people enough to be open at how many of them are having their benefits taken away. 1.3 million is a huge number of people that he shows no respect for. He even said in their manifesto that they would work with the disabled community on policy and hold them in the highest amount of regard with how they were dealing with disability welfare policy. And they've just completely gone against their own manifesto on this. Because it's not just the fact that there is a material problem here, because of course we all knew there was going to be a huge amount of it. We knew hundreds of thousands of people in poverty by 2029. All of these things are very open to the public as to what they were going to do. It's the level to which they've just tried to hide literally everything because of embarrassment, essentially. I mean, maybe even not of embarrassment, just to avoid bad PR. Because I don't think these people give a shit. I don't think they'd be embarrassed to know that they would immiserate the disabled, because they don't fucking care about the disabled at all, But at least they wanted to avoid negative press coverage. So we've had to go digging for this ourselves to try and find out what the actual kind of implication of this materially would be, because they weren't forthcoming.
Well, I'm so glad we got rid of the Tories and their skullduggery and lack of transparency in governance. It's fantastic, isn't it? That we had citizen journalists having to dig our way through a million awful labyrinthine systems put in place to try and keep the truth from you. Like, it's... And again, it doesn't surprise me that they've broken their campaign promises. They've broken every single campaign promise they ever made, of course. But it's just the ghoulishness of people like Starmer, and especially Kendall, God almighty. She takes glee in this. Going on about people taking the mickey out of the system. Did you take your chance for a £50 breakfast on the taxpayer this morning, Liz?
And the irony, of course, is that there are plenty of people who do take the mickey out of the welfare system, but it's already illegal for them to do that, and there is already legislation and action in place to be able to try and minimise the amount of fraud. And on top of that, all of the fraud is coming from outside of disability. In terms of PIP, there is an effective 0% rate of fraud as far as PIP is concerned, right? There's basically nobody who claims PIP fraudulently, and that's who they're explicitly going for in terms of who is not going to be eligible moving forward for this. And like the fact that you have people with cancer are going to be losing stuff. That's insane.
Yeah, absolutely.
200,000 people with arthritis, And like, to top it off, Kev, this quote is crazy. This is some crazy stuff. The Guardian have found an anonymous quote with regards to the idea that it's just people who are pretending to have mental health problems trying to game the system for free cash.
God.
And this is the genuine quote. Others in the party have become irritated at what they see as an organised campaign to exaggerate the impact of changes. The mental health network tend to get together, message each other, and get terribly worried about these proposals, said one MP. But nothing that's been sent to me has given me hard evidence of cases that are really at risk of losing out. Which is crazy, because first of all, it's exactly the kind of minimisation of the problem of people who have to deal with mental health in this country, right? But because they don't get taken seriously. Second of all, it's this idea that there's a coordinated kind of scammers campaign of people trying to get money, describing it as some kind of fucking network in that regard. And then last of all, there's talking about no hard evidence of cases that are really at risk of losing out, when we now have evidence from the FOI request that people explicitly are going to be losing out on some incredibly egregious cases to the tune of 1.3 million people in total, potentially. And on top of this, the Guardian are fucking protecting their source. Motherfucker, tell us who said this. Tell us who said this, Guardian. These people are monsters, and the public should know how much of a monster they really are. Also worth pointing out, too, that talking about the mentally unwell network is the original text of the article. They changed the text of the article after people complained to talk about just of the network tend to get together, not of the mentally unwell network. So the Guardian is trying to protect this MP by altering the quote in the article to take out the references that demonise mental health, even though that's explicitly the point that the MP was making.
Unbelievable shit. Fucking, the Guardian are such wankers. Thousands of people with cancer, cardiovascular disease, and respiratory diseases are more than 200,000 people. And more than 200,000 people with arthritis are among 1.3 million who could be rendered ineligible for the daily living personal independence payment, PIP, by the government's disability benefits plan, according to official data. Data published by the Department of Work and Pensions this week in response to a Freedom of Information request from disability rights campaigner Martin Bonner revealed that 87% of the 1.283 million working age people currently receiving the standard daily living PIP payment scored less than 4 points in each of the 10 categories in the PIP assessment, meaning that they would no longer qualify for the daily living PIP benefit under Labour's proposed new rules. Now, that is bad enough in of itself, but when you consider that in order to get 4 points, it has to be worse than not being able to clean yourself below the waist and needing assistance going to the toilet, that's not enough. You're not disabled enough. So you know what they're going to do. You need to get 4 in each of the 10 categories. They're just going to, each assessment's just going to have 2s and 3s on everything, and they're never going to get to the level. They're going to cut fucking everyone off. It's demonstrably evil. The Office for Budget Responsibility, the government's independent, quote unquote, financial watchdog, suggested that around half of those hit by the rule change would adapt their PIP applications or appeal rejections in order to meet the new requirements. But the OBR itself described the forecast as a highly uncertain judgment. The government's plans published last month in a DWP Green Paper are set to be voted on by MPs this summer without any formal public consultation. Just time out on that. Way to go on the decentralisation there, lads. Truly bravo. Not even going to do a consultation this time. Sparking a furious backlash from disability activists and some Labour MPs. Note the word some, not all.
Like 30 or something were the ones who are likely to rebel?
Yeah, not even most. Just some. The Party of Labour, everybody. If they are approved by Parliament, the changes will apply to new applicants from November 2026, and from then on will affect existing claimants when their claim is reviewed. Which, by the way, was very funny when Chris Bryant said, therefore, that it was fine and no one would be affected by it. Asterisks until they're reviewed. Brilliant.
Incredible. It was an incredible moment, wasn't it?
Just spectacular work. Quote, these figures show how absurd it is to exclude the changes to the PIP assessment from the government's consultation on the Green Paper proposals, unquote, said Julia Modden, Senior Policy and Campaigns Manager at disabled people's organisation Inclusion London. Quote, it is unacceptable that a policy change this big, effectively wiping out the standard category of PIP daily living, is being implemented without consultation. This is not a minor technical change. It is a serious threat to a wide range of disabled people living with substantial support needs. We are deeply disappointed that this Labour government is repeating past mistakes, proposing exactly the kind of reforms that previously caused deprivation and despair in the disabled community, while failing to save the government money because of knock-on effects on health and social care budgets. Taking away from the disabled people does not mean our needs will go away, unquote.
And that's basically the long and short of why this is so stupid, right?
Yeah.
Because not only is it evil prima facie because it's just targeting an incredibly oppressed minority, but even in kind of the most kind of raw fiscal terms, right? Completely dispassionately analysing this in purely fiscal terms, it's stupid. It's really, really fucking stupid, where you just go, we're going to cut all this money that we spend that keeps people out of all of the other parts of society that we need to spend money on to maintain people's health. And instead we're going to just increase those budgets accordingly later down the line. It's just like the kind of buy now, pay later garbage we got with PFIs, where we're essentially buying votes now at the expense of votes later. Whereas what they're doing here is they are saving money now at the expense of money later. And then they're going to throw all of that expenditure onto themselves in 2029, for example, just before the next election, or onto the next government, whoever that is. So it's not only bad for the disabled, it's bad for democracy, and of course is going to hurt the next party that comes into government. We'll have to clean up the mess.
Yeah. Despite claims that PIP has become too easy for people to claim, only about 54% of applications are successful. The government claims the new rules will ensure PIP only goes to people with serious disabilities, but someone who needs help to cut up food and wash their hair and also needs an aid to dress and be able to speak or hear would currently qualify for PIP, but would miss out under the new proposed system.
Insane stuff. Insane stuff.
You're not able to speak or hear. That's not disabled.
Get good. Get a bit of spawn point, mate.
Yeah. Oh God. DWP figures released in response to the FOI request from the Benefits and Work website show how many people with disabilities and illnesses currently receiving the PIP daily living allowance have scored under 4 points in all categories. They include some absolutely amazing ones here. 214,000 claimants with arthritis. That's 77% of all arthritis claimants receiving the daily living allowance. Amazing. So 3/4 of people with arthritis. Amazing. 38,000 with cardiovascular diseases. That's 62%. 45,000 with respiratory diseases. 55%. 38,000 with multiple sclerosis and neuropathic diseases. 48%. 23,000 with cancer. That's 33%.
A third of all people with cancer claiming PIP are going to lose their PIP. That is absolutely fucking insane. That is genuinely insane stuff.
Okay, and this is the next two are just it's madness. 11,000 with cerebral palsy and neurological muscular diseases. 1/4. I don't know where to fucking begin.
It's evil. It's evil. Like there's no other way to describe this other than evil.
Cerebral palsy is not disabled now, according to the British government.
Or at least 1/4 of people with cerebral palsy are judged to be not disabled enough, essentially, which is crazy.
26,000 with psychotic disorders.
23%.
23%. So again, nearly 1/4 of people with psychotic disorders, not even just like psychological issues, psychotic disorders are not disabled enough.
Speechless.
Jesus Christ. It's like how have they possibly worked themselves into this situation? How is this worse than just doing a fucking wealth tax, you monsters? Really?
But have you considered that Martin Taylor, Gary Lubner, Clive Wallack and Trevor Chin, they don't want their wealth taxed though. The billionaires who donate to Labour might have their wealth taxed. And they worked super hard for that. They worked really, really hard investing in those hedge funds.
Yeah. The problem is the psychotic disorder patients can't afford to buy a box of the football for Keir Starmer. So you shit out of luck, lads. The figures also include how many new applicants with different conditions would over time fail to qualify for PIP from November next year if the plans are voted through. The 4-point rule would also have a big impact on people with mental illnesses, a group of claimants that have faced a media and political onslaught. Around 282,000 claimants with anxiety and depression would fall foul of the 4-point rule. Jesus Christ. 282,000. The government spokesperson told Big Issue, quote, "This data is partial. It doesn't reflect the majority of people who are currently getting PIP will continue to receive it, nor does it take into account our wider reforms to get people back into work."
Why? Why would it take into account the reforms to get people back into work? None of this is about work, because this is the analysis of a benefit without a work requirement.
Yeah.
This is analysing PIP, which people in work get. It is not dealt out to people specifically who are out of work. It is everybody who has the disability, regardless of work status. Your reforms to get people back into work, whether they're a good one or whether they're a bad one, you know, I'm not going to make a judgment on the totality of them, but it doesn't matter. No, this is relevant to the discussion about people who get PIP who will lose PIP, especially given that the people who are in work with PIP are now less likely to stay in work, regardless of what those rider reforms are at all. I mean, even if they're good, I don't think they're going to be, you know, thousands of pounds worth of good, you know?
Yeah. Also, it doesn't matter if the majority of people are going to keep their PIP, in the sense that it's still bad that these people aren't. Like, yeah, lots of other people won't lose their PIP. That's cool. But what about the tens of thousands and indeed hundreds of thousands of people with arthritis or psychotic disorders who are going to lose their PIP?
A third of people with cancer.
Yeah, like, that's bad. Don't go, look over there. Look over there at the people that you're not talking about. What sense does that make? You pricks. Honest to God, these people are evil. They are evil. The government spokesperson continues for some fucking reason. This government will always protect the most vulnerable. It's in our DNA. I'll leave that up to you to judge that statement, chat. The social security system will always be there for those who need it with the most severe health conditions, which apparently doesn't include psychotic disorders. Okay. And we will ensure their income is protected. No. Especially given we haven't even talked about the fact that if you're under the age of 21, you're fucked or 22, whatever. You're fucked either way. You get nothing.
Well, cancer and psychotic disorders, not severe health conditions, Liz.
Technically, this isn't Liz Truss, I don't think, but yes, I get the point you're making. Yeah, I mean, they are. They just are. Everywhere you cut it, their rationale for this is a lie. It's just a lie. They're doing this to save money and nothing more. And they should be honest about that. And then see Labour MPs still fucking vote for it because they're bastards. Too many people are being let down by a system that traps them out of work and holds them back. 1 in 8 young people not working shows the system is broken. Our reforms will support those who can work, backed by £1 billion additional funding to guarantee tailored help. This government will support everyone to thrive.
And again, it's just entirely unwound by the fact that PIP is not a work-related benefit. It's just so nakedly disingenuous. And again, they say that oh, well, the number of people not working shows the system is broken. But no. What system? What system is broken here? Again, all we've done is try to cut back the welfare state. So it's the most miserly in Europe, basically. It's one of the most miserly healthcare systems. It's one of the most miserly welfare systems in the kind of the West more broadly, in the global North, you know. And at no point has this helped people back into work. Our labour force participation has stayed pretty stagnant throughout that time since we started continuing with this dynamic ad infinitum, you know.
Yeah.
And they say, oh, well, hang on a minute, this is proof the system is broken. No, this is proof that the healthcare system is broken. I would finish off by saying that throughout all of the discussion of this, all we talk about is the welfare system as being the failure here. No, the broken link is the healthcare sector. It was reduced in funding as a percentage of GDP every single year from 2010 until 2019. That was the longest sustained reduction in healthcare spending in UK history under Osborne and Hammond. And then we had the pandemic, which we're overexposed to because we're running on razor-thin margins whilst we cut those budgets. Far behind countries like France were spending double, 2 percentage points higher on healthcare at the time. So we were overexposed due to increasing waiting lists before the pandemic, and then also the pandemic destroying the healthcare service overnight as well. And that's why we have a lot of people who are disabled. But 40% who claim incapacity are on NHS waiting lists. There's a healthcare issue, not a welfare issue, but the DWP refuse to talk about it in that way, and they try and frame it as a function of the way the welfare system is designed that we have so many people on welfare, rather than looking at literally any other potential cause, because they need to pretend that it's that to justify destroying the lives of the disabled. Hey there, if you enjoyed the video, make sure that you like and leave a comment. That helps the video out in the algorithm. If you subscribe and ring the bell, it'll let you know when I go live. I stream every day on YouTube and Twitch. You can also follow all of my socials down in the description. And if you want to support me in a more financial manner, there's a join button for memberships. It's just 99p to be a member on YouTube, as well as a Patreon, and there's some merch there as well. And hopefully I'll catch you on the next video. Take care.